Hey, everybody, welcome. So this is kind of going to be not super structured. We just thought, really over the past year in particular, it seems like there's been kind of more of a focus and a lot more questions from the medical students that I've talked to about research and trying to get involved with research. And I think probably part of it is the USMLE Step 1, switching to pass or fail. There seems to be more of an emphasis on finding other ways to sort of stand out besides the USMLE score. So overall, there's been sort of more, as I talk to med students, more anxiety about getting involved in research. How do I get involved in research? What do I do? What kinds of projects? What kind of mentors can I find? So that's what sort of triggered this is a part of the PSRC mentorship committee. And we want to do some sort of medical student mentorship webinar that we've had past couple of years. We've had similar sort of things, but focused on different things like applying and things like that. But this year we figured focusing one on research and answering questions about research. So there's nothing really structured. There's no talks or we're not lecturing. It's really more an open forum to answer questions. And if any of you attended the PSRC meeting in Toronto, we had that sort of the mentorship brunch. It worked out pretty well. It was more just kind of, we took questions from the audience and ran with it. So I think we should do it that way for this as well. So anybody else have any comments, Newport, and anything else to add?
I think maybe we could just go around with the panelists that we have tonight just to introduce themselves and maybe just say where you're from, what year in practice you are, and then kind of what your research focus is. And then maybe that'll generate some questions from the audience. So Al, I think maybe you should start.
All right. So my name is Al Hassanein. I'm in my 6th year of practice at Indiana University. I'm a microsurgeon. I do clinical research focused on breast cancer reconstruction and lymphedema, and I have a basic science lab focused on novel ways to treat lymphedema. That's me.
Cool. I'm Nupur Ganguptai. I'm a pediatric plastic surgeon in Chicago at Lurie Children's Hospital. It's affiliated with Northwestern. My big interest in research are clinical outcomes, specifically looking at outcomes for transgender surgery in adolescents, as well as cleft and craniofacial. And then I do some medical education research. And one of my collaborators is on here. And since she's screen right to me, I figured, Sue Jordan, you can go next.
Okay. My name is Sue Jordan. I'm at Northwestern. I'm starting my 5th year of practice. Also a microsurgeon. Half of my practice is gender affirming surgery. The other half is breast cancer, lymphedema, microsurgery, and some pelvic reconstruction. I have 2 research aims. A lot of it has to do with access to transgender health, including medicine, mental health, and surgery. We have a big focus on trans youth. And then some anatomic studies related to axillary lymphedema. And then my basic science work is actually on muscle reinnervation, looking at electroconductive scaffolds for muscle reinnervation.
Erin, do you want to go next?
Sure. I'm Erin Weber. I am in my 3rd year of practice, also at Indiana University. I'm a hand surgeon, and clinical research focuses on tendon and nerve injuries and outcomes with various repair techniques. And then basic science research focuses on peripheral nerve injury and regeneration, specifically looking at how muscles signal to the nerve to specify targeted reinnervation or regeneration. And I tag Sammy.
All right, so I'm Sammy Tafaha. I am in my 4th year in practice, and I'm at Johns Hopkins. I also have a dual appointment at the Curtis Hand Center, so I go there 1 day a week. And my research is, some basic science, but mostly translational, and I'm trying to find new approaches to improve outcomes following nerve injuries. So, small protein therapeutics, various devices, imaging modalities. And then I have some ongoing clinical trials stemming from work in the lab. And yeah, that's me.
Michael, do you want to go next?
Sure. My name is Mike Alperovich. I'm an associate professor at Yale. I've been in my 7th year of practice. I've actually, medical students have been a big part of my research interest. I do research in craniofacial surgery, and I've taken 2 medical students every year now for I think 5 years, and they've been a huge part of my research team, and honestly part of the best part of being in academics. But most of my research is in craniosynostosis and cognitive outcomes using functional MRI or EEG to study how these children develop over time.
And then last but not least, Joe.
Hi, I'm Joe Ricci. I'm one of the microsurgeons in the Bronx at Montefiore Medical Center. I'm in my 5th year of practice. My research is mostly clinical. We are running a randomized controlled trial right now on the use of transaminic acid, funded generously by the PSRC grant. And most of it focuses on clinical outcomes associated with breast reconstruction or other microsurgical topics.
All right, so we can just start out with, if anybody have any questions they want to open this up to.
Al, I got a question for you. What's your number one piece of advice for a medical student looking for some research to do to help them get into plastic surgery and maybe set the course for their future academic career?
One thing is, so obviously find a good mentor. That's a big thing. So, and then and that could be someone at your institution, or we have our mentorship match in the PSRC as well, and find many mentors, get advice from many different people, and it'll help sort of things that are a recurrent theme are probably true. Sometimes you hear things that aren't necessarily great advice, but pick up as many mentors as you can. Number 2, I think what's important is, especially as you get busier or take multiple projects on, take projects on that you actually find interesting, because I think it's less sort of onerous and work and difficult if you're kind of enjoy the question and you want to answer the question, and you kind of look forward to figuring out what your study is going to show, versus just taking on something that you don't find particularly interesting and you're just doing it just to do it. So yeah, find projects that you like. And it's obviously going to be more difficult early on when you're looking for anything to get started, but as you get more opportunity, you could potentially be more selective for taking things that you want to do, and don't take on too much. I know there's a tendency to try to being as productive as humanly possible, but at a certain point, your wheels are spinning without getting anywhere, and then you end up makes it easier to miss deadlines or not to get quality work done. So it's not quality, it's quality over quantity. So sometimes, optimally you do both, but definitely don't overexert yourself or spread yourself too thin where you can't really do well in a few projects.
You got questions coming in the chat, Al?
We do. So the first one is, do you recommend cold emailing to find research opportunities? So maybe we'll just take it in turns. I don't know, Sammy and Aaron, if you want to start with that one.
Aaron, you want to go first?
I can. We'll see if we agree here on our answer. I feel like cold emailing is probably not a very efficient way of finding someone to work with, especially if they're not in your institution. Just on the flip side of it, I know that we get a lot of emails, each of us, and some weeks are crazy hectic and those emails don't get answered for a week. And when they're not answered right away, we tend to forget about them. So I would rather advise that you look at who's doing research in the group at your institution. And if you don't know, you can ask other higher level students or residents, or even just do a PubMed search and see who's got manuscripts under their name and how many, and approach those people that do a lot of research. because they're more likely to have ongoing projects that maybe are halfway completed that need some assistance, and probably more likely to identify projects that are easily completed in a shorter amount of time, like a year, say, so that you're guaranteed, if you put in the work of getting something that's publishable and then that you can put on your application. So I would say cold emailing, probably not the most efficient way of doing it.
Yeah, I agree with Erin. I think, it depends on how you define cold emailing. I think if there's somebody, ideally in your institution who you know about, you've heard good things about the work that they're doing and their mentorship qualities, and you're drawn to their topic area, and you don't have a really easy way of getting a personal, introduction, then I welcome a med student emailing me and saying, hey, I'm really interested in the work you're doing. I especially appreciate it when they tell me why they're interested in what I'm doing, so that I know it's not just kind of a form email that they're blasting off, throughout the universe. But then, usually that would lead to a Zoom meeting or an in-person meeting where we can kind of feel each other out and see if it fits. So I think if you do your homework and you think it's, makes sense to explore that, then, I think an email to that faculty member is okay and welcome. But you do have to not take it personally if you don't get a response, because we get so many emails every week and every day. And so, I also don't mind if somebody sends a follow-up email if I don't respond to them right away.
I think cold emailing could be useful for people who don't necessarily have the program at their school, right? Like, I've received emails from a wide variety of people, some in the US, some outside the US, which is a whole different set of logistical issues sometimes for us associated with visas, perhaps. But I've had a student who emailed me she said, I don't have a plastic surgery residency program. There's no one here really doing it. There's a few local guys that kind of just do cases. Could I do a project with you? And I'm always more than happy to meet with people via Zoom or talk to them, at least, as Sammy was just saying, to try and feel out, is this something we think we have a project we can get finished? Can it be done without accessing our medical records, say, sometimes for outside institution people? And then the only other thing I would say on that is I've had good experiences and bad experiences with that, where I had a student, just for argument's sake, who emailed me and said, can I help you do a project? And it was like pulling teeth, and the project never got finished. And I didn't really know this person, and they weren't at our institution. And I think that doesn't help your chances in terms of trying to, get a letter recommendation or get a, residency position. I think following through, regardless of if that person is in your institution or outside, I think is of critical importance, is sort of finishing what you start.
Yeah, but if you are going to reach out to somebody and send that cold email, make sure it's personalized and thoughtful. I will not respond to an email where it's clearly copy pasted and I see my name and peripheral nerve regeneration in different fonts, and clearly it's just kind of a generic email that they're sending out to people, just looking for any research opportunity under the sun. So, I think, if you don't have a way to get a direct introduction and you send a thoughtful email, you have a decent chance of getting a welcome response.
I want to echo what a couple of people have said. Like, if you email me on a Wednesday, you're going to get a response. And if you email me on a Thursday, it might be like 3 weeks and I'll forget about you. Don't take it personally. It's just, what days we're in the OR and can respond right away. But if you really are interested in somebody's research and you're like, I absolutely want to at least get to know them. And maybe you end up just talking about your practice pattern or your career choice or just general life advice, send another email a couple of weeks later if you haven't heard and you really want to talk to them. And I'm always happy to set up Zooms with people and kind of gauge up people's interests. And sometimes it fits and sometimes it doesn't. But there's a little bit of persistence that has to happen.
And I definitely agree with everything that's been said about don't take a non-response to an email personally, or mean that take it as a no. Because I have like a laundry list of emails that are intentionally still clicked as unread. I'm like, I have to get to those. And all of a sudden I'll find some time to go through them. I'm like, wow, I haven't responded to this email like in 3 weeks. And then there'll be like an email from a med student that I intended to respond to, never got a chance to. So yeah, feel free to follow up to send a follow-up email to if you haven't heard anything, because I think none of us in academic medicine would just intentionally ignore a student trying to reach out. And we give some sort of response. So if you haven't heard anything, then either we didn't get it somehow, or we just haven't had a chance to, and it got buried in like a huge mailbox.
We've got a couple more questions in the chat, and then someone's hand is raised. So I think we'll go through the chat ones, and I won't forget the person whose hand is raised. So this one, I think maybe we'll change to a more general question. So the question in the chat is, how can an international medical grad find mentors in the US to get effectively oriented in order to do cardiothoracic surgery residency in the US? So I think I would change that more, since we're more of a plastic surgery organization. How would you all recommend someone who's an international medical grad find a mentor in the US to get some of those research opportunities to get into residency?
Well, one thing is to take advantage of some of the national organizations that have mentorship kind of matches, like PSRC, where we have a direct match, and you could use it as a launching pad to find other mentors as well. And at the meetings, at the PSRC meeting, and then I know ASPS has Propel, like mentorship team groups, where there's potential for projects and other stuff for mentorship. So I think just taking advantage of those national meetings where there's organized things for mentorship is a start.
Have any of the panelists had experience with an international medical grad, either in their lab or doing some clinical?
I did. I had one of John Persing, my former boss, spent a lot of time in Iran and had made some contacts with some plastic surgeons. And the son of a plastic surgeon actually ended up being a postdoctoral fellow with me for 3 years. I think, and I'm sure everyone on this panel gets the same. I get at least 3-4 emails a week from someone from abroad who's looking for a postdoctoral fellowship to try to get into residency. I think if you're doing it, and similar to maybe this panel, is just think of your audience. I mean, none of us are cardiothoracic surgeons, so I don't think any of us could speak about CT surgery residency. And so when I get emails from people and they say, I've done work on GI and I'm really interested in working in your lab, I think I assume that I don't even respond to those anymore, just because of the frequency, and it seems so on targeted. And then what ends up happening is, not uncommonly, one of the other faculty will forward that email to us, because and 5 of us have gotten the exact same email with the exact same wording. And I think so. If you're in CT surgery, then one, do CT surgery research at your home institution, or find some background to show your commitment to this field. And then 2, reach out to CT surgeons. I think none of us know who the players are in cardiothoracic surgery. We probably can't get you a residency there. So I would just try to, like everything else, be as thoughtful in your solicitations as you want people to be in their responses. And I think that usually be matched.
I've had 2 international postdocs, and interestingly enough, I never really thought about this, but they both had done a rotation at Hopkins. One of them for 2 weeks, one of them for a month. They both came from the UK, and were able to arrange those clinical rotations. And so actually, they no longer became a random email from somebody abroad. It was actually a person who I got to know, and then it was easier for me to feel comfortable taking that leap of faith to bringing them into the lab, because I knew who I was working with. So it's not easy to secure a lab position as an international medical grad trying to get your foot in the door. And so I sympathize with the blast emails, but I think it's very ineffective. And I think trying to find some way to introduce yourself in that case is helpful. For better or worse, if a Hopkins med student cold emails me, I respond differently than the international medical grad that I'm going to have to secure a visa for. And there's no way that I can really kind of get to know them and understand where they're coming from. So I think trying to find some soft introduction in some way to make yourself a real person, and then try to get your foot in the door that way, I think makes sense if possible.
Great. Thanks, everyone. We have an audience raised hand. So Cheech, if you want to unmute and ask your question, that'd be great.
Thank you so much. And Dr. Hassanin, thank you so much for inviting me to this. And the question that I had for the panel is just that mentorship, I've noticed that mentorship is really, really important in just almost getting your foot into the door in plastics, but then also getting involved in plastics. So, and it's a question that I've seen a lot of students ask like in different settings. So the question that I have is just that, like Dr. Hassanin mentioned that there's the student mentorship program for mentors to be kind of like matched, for students to be matched with the mentor. So the question is just like, one is just like, what are the things that a student can kind of do to really cement that relationship, but then also really maintain and capitalize that relationship, but then possibly help them either land a research fellowship position or even just kind of have somebody that can vouch for them when it comes to like application season. So what are the things that you guys have experienced in order to kind of not only jumpstart that relationship, but then also maintain that, because like there's times when like time can pass and that relationship can be lost as well too. So
I think that's a really great question. And so I think I'm going to let everyone answer it. I'll chime in with a couple of my own thoughts. So the number one thing for me is really consistency in that relationship, and then always having that next meeting set up. So when I mentor a medical student, whether it's clinically through their rotation, and they're trying to improve their clinical skills, or it's for a research project, I always set up a little agenda with that kind of first meeting. And then the line item at the very end of the agenda is always, when are we going to meet again? And what is the timeline for what I've asked you to do? And I would encourage you with your mentor, to also think about those things, like when is the next time? And sometimes that timeline gets changed because you all are busy students. We are busy faculty members. But just making sure that you have that next step already set up. So for example, if we were working on a research project together and the first step would be, I want you to do a literature search on this topic. I might say, do you think you can get that literature search done in about 6 weeks? And then I'll have my scheduler set up a meeting for us to meet again. And so then you kind of have a task to do. And then we have an agenda in terms of what's going to happen at that next meeting. And I think, again, that consistency is important. On the flip side to that is if you have a mentor that is not meeting with you on a frequent basis or is not giving you the resources and support you need to be an effective researcher or to really do a project well, then that's also not a good relationship for you as a student. So I also think gauging your styles and how that works is also going to be part of that relationship. But I'll let everyone kind of
Sure. I'll jump in. I think, if you apply for NIH funding and you have a K award, which is like a mentorship award, they always look to see, is your mentor for your NIH K award someone who has a track record of mentoring junior faculty? And so I think by the same token, if you're going to ask someone to be your mentor, it doesn't have to be the chief or the chair of the department. And oftentimes those people are really stretched thin. It can be someone who you just feel like is invested in your success and going to support you. And so I think talk to other people, talk to other medical students and say, who have you had a good relationship with? And generally, if someone was a good mentor for someone a little older than you, either at your medical school or someone else that they'll probably be a good mentor for you. And I think in terms of your question, I do think mentorship is really important. It's important at honestly at every level. I mean, I think chairs speak to have mentors as well. They just different stages of life. So I think mentors will help there's someone who can be honest with you about the things you're doing well, and also be supportive, but also appropriately critical if things aren't going well. And I think you need someone that can be both for you, so that you're just your possible best. So I think it may not always click with the first person that you find. And sometimes it's personality, sometimes it's time availability, sometimes it's just even proximity. But I think maintaining and finding that relationship is important. And don't be afraid. I mean, I think everyone on this panel says they're busy, but if you send them a text or you send them an email, just checking in, people love getting that. People love to hear how you're doing. I saw a really great case, or I love hearing from an intern. I just I did my first, facial reanimation. I thought it was so much fun. Those kinds of things keep that alive. And I think, even if sometimes, and I think especially in surgery, we're not great about positive feedback, but people notice everything, and the hard work and the dedication and that's all recognized. And believe it or not, even if it's not always verbalized, people always notice.
I think another thing that's important to remember, maybe not as you initially start out, but as you continue along your career, is that you will have many mentors, and you're not going to have one mentor that does everything for you. You may have a mentor who you go to for research and you have a great relationship, and you have somebody who's different with a different clinical interest. And so it's probably not going to be the same person. It may not be somebody from your institution. Probably should be, as you develop and grow, people from various aspects and locations.
I just want to go ahead, Sue.
Go ahead, Joe. No, go.
I was just going to follow up on the second point of your question there, which is like, how do you get somebody to vouch for you? And I think for me, it's more than just like, it's going to relate to something I was saying before. It's more than just knowing you. It's like knowing that you're going to be a superstar, right? I want to go to somebody I know and say, this is my guy. This is someone who is going to get the job done. He's not going to let you down. And I was thinking, Nupur was saying about she's going to give you 6 weeks to do a literature search. I want to meet somebody who I say, it's get back to me in 6 weeks, and in 3 weeks, you're getting back to me saying, here's what I got, here's what I did, and what can we do to take the next step here? So it's not really just starting things and being pushed along. It's can you show that you're self-motivated and really and get it going. And I think in terms of, letters of recommendation and phone calls and all that other kind of stuff, I would tell most of the people who work with me that if, they need to work with me for at least 6 months, or, I have to get some steady amount of time working with them, and not just one project over a year or something like that. Some steady amount of work for us to really go ahead and so, give a very strong support for an application.
Yeah, I completely agree with Joe. I think the number one thing you can do is just be a closer. Don't start projects and leave them hanging. You have to imagine, for us, we're super busy. And if we take the time to create this project and and set the course and talk about the aims and how are we going to do it, and then, maybe we have a meeting or two, and that's all invested time and effort that we're kind of putting into this collaborative project together. And, we all know how busy medical student is, and sometimes your interests change. But I think it does make it harder to speak in a glowing fashion about somebody who's not getting the job done and doesn't seem fully committed to your collaborative work together. And, if you spend an extended amount of time working with somebody, at least for me, I try to find the best in that person when I'm writing a letter and speaking on their behalf, but try to make it easy on us and do great work and be excellent. And then it just makes it a lot easier for us to go and call our friends on the phone and talk about how great you are with specific examples.
Yeah, we started talking about, like cold emails and whatnot. And I will say, we get an email, and we have so many odd Zoom calls, and so many out of the Zoom calls turn into a real working relationship. And some of it is fit, and some of it's time and persistence. I think, the agenda is really important. Like, have a clear agenda. Like, I am calling you because I want a research project. I want to have a paper for my application, or I'm calling you because I'm really interested in this particular subspecialty of plastic surgery, and I want to learn more about lymphedema, or have, like a goal. And it makes the conversation a little bit less superficial, a little deeper. I think the mentor's responsibility to you is also to tell you what our bandwidth is, because realistically, at the end of it all, I have about 2 students who have risen up and been persistent enough and kept in contact enough that I really feel like I have a deep relationship with them. I would be more than happy to write them a glowing letter. I have another grad student, and I have a postdoc, and I only have the bandwidth deeply mentor a couple of people. And if you happen upon somebody who's like fabulous, like Newport, and she's already got like 10 mentees rolling around her, she might not have that time for you. And so it's our responsibility too, to be very open about our bandwidth. But, you know, you kind of have to gauge out that relationship. And if you're really interested in something, be a little persistent about it. And I hope that, you know, someday those folks that I like really deeply mentored, you know, 3 years from now, just touch base with me and be like, hey, I did my first deep. This is amazing. Just wanted to let you know, and have that comfort with you. You know, that's my goals.
All right, maybe we should move on to the next question here. Let's see, the next question looks like advice for students which have no home program / attendings that do research, and 2 students who have never done research before, where should they start off? Joe, you want to start out with this one?
Sorry, can you hear me out?
Yeah.
This is advice for students with no home program. That's the question we're in the chat we're looking at. Yeah, I think this is a very challenging situation. You know, there aren't that many plastic surgery programs, and so I think a lot of people are understanding of that. A lot of people like us that do research or have lab space are understanding of this issue. I think a couple of good ways that we discussed already that this could be accomplished is, number one, you know, the cold emails, I think is applicable in this situation. But I think better than that also, which we discussed a little bit earlier, is, you know, perhaps if you're attending a meeting, you know, the registration fees for students in many situations is extremely low or zero to attend certain meetings at the ASPS or the PSRC, and you can attend, you can meet people, you can sign up for the mentorship panels, you can sign up for the mentorship match, you can get your foot in the door. It may be that, you know, you're paired with me as a mentor and a mentee, and maybe I don't exactly do the kind of thing you want to do, or I'm not physically located close to you to meet, but maybe I know someone who can get you in, you know, maybe I say, oh, you're from Indiana, I put you in touch with Al, and then that's sometimes how you can get your foot in the door.
Yeah, cross-institutional, like cold emailing outside of an institution for a project is pretty tough, because for IRB purposes, unless it's like a systematic review of the literature or some survey, which has a waiver of IRB, it makes it very difficult. So yeah, I agree with Joe. The national committee or the national organization thing is probably the best bet, or find someone at your institution who isn't necessarily a plastic surgeon, and then get involved with research that way. Even if you're interested in plastic surgeries, it's not like everybody expects every applicant to have only, you know, high impact or like PRS first author manuscripts and nothing else. I mean, if you're involved with some research and get that experience, that's helpful too. So take advantage of other people at your institution that aren't necessarily plastic surgeons that can do research.
Yeah, and I want to chime in one more thing there, Al, based on what you just said. That I think also there's a possibility for you to interface with whatever plastic surgeons are at your institution, even if they're just community guys. They probably know other people that they might be able to put you in touch with. So even if they're not researchers, they probably know someone that they train with or friends with that could assist you. Sorry, thank you.
Yeah, for better or worse, if you are interested in plastic surgery, you don't have a home program, you're probably going to want to do a dedicated year. And so that might be another way of thinking about this, is how do you get into another institution for a dedicated, hopefully funded research year? I've had 2 medical students from other schools come and work with me, and both of them did a short 6-week rotation, elective rotation. And so I think it happened organically that way, but I would probably do that moving forward before I accept anybody that I can't actually get to know, you know, in a more organic fashion. So consider looking for a elective rotation at a place you want to target, do a great job, impress the person you're working for, and then hopefully you can get into a, you know, a year-long spot. But I think you'll probably need it these days. especially if you don't come from a program that has a program to support you.
I may be in the minority, but I think the deep, meaningful research is more important than the exact topic of research. And we interface with so many specialties. I mean, you can go to neurosurgery for peripheral nerve research, or just neurosurgery for spinal cord injury research. You know, it's still applicable. Orthopedics for bone healing. Inflammation is in every specialty. Wound healing can be in dermatology or rheumatology. There's a lot of other places that do related research. And I think as long as you are showing that you are willing to put in the work and think critically and follow a project through to the end, you can make almost any research related to plastic surgery. That's the beauty for specialty.
I think, can we maybe tackle the second half of that question? So it's a good question. So for students that haven't done research before, where should they start off? So I think that's a great question. We're fortunate at the program I'm at and Sue's at, they have has built in their medical education curriculum is what we call an area of scholarly concentration. And so there's basically a research summer that's done between the first and second year. And part of that is that they take weekly classes really on how to get started with research, basic statistical methods like writing an IRB, like trying to work on a grant. Now, for students that either don't have a program like that or are just really fresh to research, what advice would the panelists have?
If you have it, get paired with a senior student, you know, that's kind of blaze that trail ahead of you. Sometimes you can like piggyback on their work and then you're kind of doing it together and learning those skills as you go. You can kind of both get on that paper sometimes. Honestly, I'm always looking for someone who can really do statistics. So if you want to just like take an online R course, I would love you, like just come on over. But that's, you know, that's like a technical skill.
Yeah, I think we're all used to having students from and residents from different sort of skill sets or experience for research, from having done nothing before to, you know, excellent statisticians and decent writers. And so don't be intimidated by the fact that you haven't done any research, because there's always still a role for students in different projects. And it could be something as simple as data collection or medical record reviews where you're entering data in the database and being involved or contributing in some sort of way. So don't let that stop you. And then that's how you build up on the skill set. You're getting the experience of doing that and get better at it.
I think this next question is great for all of the panelists, especially since we have pretty broad research involvement as attending. So how did you balance your research interests, especially bench research, when you were a resident? How do you continue to do this as an attending? Aaron and Mike, do you maybe want to start with this one?
Sure. I think so. I think, you know, you have this finite period of 6 to 7 years where you can become, you know, learn these core skills that are going to guide you for the next 30 years. So I do think I would spend residency really trying to become a competent surgeon, good decision making, and I think if there's an area of interest that you like and it's something that you're excited about and you want to use your, you know, free available time to do it, I recommend it. But I don't think. I think it's okay to really use that concentrated period of time for residency to become a good clinician. In terms of balancing it later on as an attending, I think it's tough. I think part of it is that if you let your clinical work, you can feel if you get, you know, it's once you get busy, it's very hard to get unbusy. So I think you have to be deliberate about it, and you have to sort of force yourself to have time to do it. And sometimes that requires giving some things up, whether it's whether it's cases or types of clinical work, maybe narrowing some of your clinical practice, sometimes giving up money. So I think part of it is just being committed to it and wanting to do it. So that's been, I think, I think it's hard. It's always a balance. And I think you go through periods, and sometimes you have a grant deadline, or you have a project that has time sensitive finish, and you really push towards getting that done. And other times maybe you have a busy stretch of clinical work. But I think in order to, if you let, just like everything else, if you let the clinical work dominate, there's always more work to do. There's almost more patients, more to see, and more cases to operate on. So I think you have to really dedicate time to it and carve out time. And I literally will just block it on my calendar, so my admin can't fill it with more things to do, so that I know that I have time to get what I need to done. And as I get closer to some sort of funding deadline, I may put in more block time just so I can make sure that that gets done. And that's been, I think that's been a learned process, but I think, part of being successful is being focused. And I think part of being focused is being willing to say no. And I think you have to be willing to give up a few things and be able to do that if you want to stick to research.
And in terms of bench research and residency, I think that's almost impossible. Although I think Sami Tufaha may have been doing that when he was as a resident. But besides Sami, I think he's the only exception I know. It's pretty much impossible. So I think most of us that do basic science bench research either have gotten a PhD, which I haven't, or have spent dedicated time of some sort during residency. Like I spent 2 years, middle of my general surgery residency, doing a research fellowship. And so if that's something you're interested in and you don't have a PhD, then maybe programs like University of Michigan, or I think Northwestern has a year of research as well. Those kinds of programs may be good for that, because you probably need the additional sort of training in the research if you haven't gotten any kind of formal training.
Yeah, I mean, you just have to put in the time. You have to put in time somewhere. I happen to have a PhD, but I still needed that time in the middle of residency to like catch up. The field moves by so fast, and you're in training for so long. You need at least a footprint in there, stepping stone. And the $1 million question of how you balance it as an attending, I'll let you know when I figure it out.
I echo that 100%. If you're really interested in bench research, I did it both ways. I took dedicated time out from residency, and I also had a small project that I did towards the end of residency. It's really difficult as a resident because you're not always manager of your own time as much as you may be as an attending, even though that's very difficult. And I don't have the answer to that yet. But I think if you are really dedicated, especially to bench research, you're going to have to take time out. And in my opinion, it has to be at least 2 years to get a good project really accomplished. So some programs have that, residency programs have that built in, USC does. And so if you're interested in that, you should look for a residency that has that opportunity.
These next couple of questions we sort of touched on, like how do you find a remote research opportunity and arrange rotations in the US? So the next one is, could anyone recommend a book to give a good overview of plastic surgery at a medical student level for those of us who do not have a lot of exposure to the field? And this is aging myself a little bit. So I think I forgot to tell you, this is, I'm going into year 8 in practice. So like, myself and like Al and Sue were like a little bit more senior. I think the book that was classic for us as medical students was either the Michigan manual that you stuck in your pocket, or Plastic Surgery Secrets, which was like a Q&A book. And then I think they just came out with like the Essentials of Plastic Surgery, like UT Southwestern manual, like the first edition when I was a medical student. And now I know it's on a few iterations. So I think, we may not be the best people to ask in terms of what the medical students are using now, but those are all things that we used as medical students.
Yeah, and there's like that really thin one, which I think is also called Essentials. It's like that red book.
The red book.
Yeah, that's like the most basic to start out with, for sure. And no.
You're dating yourself, Al. It's not red anymore. I think it's like teal color or something.
Yes, Al and I are a different generation, Joe. Thanks for rubbing that in.
Yeah, I mean, I think the most important thing also, just remember, no one's expecting you to know how to do a surgery. And I think when I tell medical students about how to prepare, I say the thing that you really should know how to do is know anatomy. If I point to a bone, just know that's the lunate. I think that's, I'm not asking you like, how do you drill the K-wire? So I think from that perspective, that's something that's finite and you could learn. And then just the one other thing I would say is, and I tell the students too, you will not see the breadth of plastic surgery in your rotation. So whatever you do, just supplement it. Know that what you're going to see on rotations is very limited, and you may see a breast-heavy rotation, but you may not see a lot of hand, or you may see a lot of hand, but not a lot of craniofacial. So just make sure that you at least cover the basics. And when I have people from outside med school, especially when they don't have programs, reach out, one of the things I always tell them is just learn the vernacular. And I think one of the things you can do is just get the plastic surgery journal, PRS, and just flip through it and just see what are the topics, like how are people talking about things. And you can really quickly tell when you talk to med students, someone who's been exposed to plastic surgery versus someone who hasn't. And I think the more you learn to speak the language, I think the more it'll be, more you'll be able to kind of fit into rotations in the fold.
Yeah, and I would say if you're a sub-I, focus on the case at hand. It would be very overwhelming to say, I'm going to learn about the breadth of plastic surgery from a little book with little bullet points on it. But anytime you're going to a case, look up some review articles, get some depth into it, kind of understand, the pathophysiology a little bit, and certainly the anatomy. And I totally agree. Don't worry about the steps of the procedure, because that's going to be a waste of your time at this point. But I think don't become overwhelmed by trying to learn everything all at once. And anytime a learning opportunity presents itself, interesting patient on rounds, certainly any case that you're going to go scrub for, just spend some time learning about that, and then you're going to accumulate knowledge. And I personally wouldn't hold it against anybody if they didn't know something about a case that we weren't working on presently. And so I think you'll find medical students who somehow accumulate this amazing breadth of knowledge, but I think most of us wouldn't ask you questions or expect you to know about something that we're not, that's not presently being dealt with.
And do know about the patient, like themselves, like read their H&P or something, because it is kind of annoying when a student asks, like, oh, well, what are we doing? Like, why are we here? It's like, you literally know nothing about this patient. Like, it's like, glance through the H&P at the very least and have an idea of what we're doing, and like the general idea of what we're doing and why.
That's always the number one question of my OR to medical students is, why are we here today? And really, if you just read like even the one-liner like assessment of the patient usually tells you that answer. But that to me tells me that a medical student has looked up the cases beforehand. And sometimes you get put into a situation where you maybe were not supposed to be in that room that day, and so you haven't had time to do a lot of in-depth stuff. But that's something you can look up in pre-op holding, is just look at the last clinic note and say, why are we here today? Okay, can you describe how any current medical students that you work with integrate into your labs and what some of their typical responsibilities are? I think this will be kind of a good one to just showcase everyone's labs. So maybe Al, do you want to start and we'll go down the line?
Sure. So for students specifically, Indiana University has a summer program called the Impress, which is between the first and second year of medical school, where students spend 8 weeks in a lab, and they basically, so it's a whole organized thing. It's institutional specific, but they interview with people to be in their lab, and then there's like a match for it. So that's the only time students are sort of participating in the lab itself. And what they're doing is, we have a mouse tail model for lymphedema and tried sort of different gene-based approaches to try improve and prevent lymphedema, and they get plugged in one aspect of the project. For instance, a student last summer was involved with optimizing something called intravital microscopy to be able to visualize the lymphatics. So, but besides that organized program, it's hard to, when students approach me for research, usually they get plugged into some sort of lower lying fruit clinical research that's like a smaller retrospective review or something that's easier to get done in a limited amount of time.
Sammy, maybe do you want to go next?
Yeah, so I have one medical student, Erica Lee, who's a MD PhD, who's in her third year in the lab, and she's functioning at an extremely high level. She's leading a couple of projects. One of them is looking at small protein therapeutic delivery using a nanoparticle delivery system in a rodent model for nerve injury and repair. And then she's also has created a model for neuropathic pain, neuroma pain, and is looking at different interventions. And so she's a great example of how, my ideal scenario is that as the student progresses, they start to teach me stuff and they take their project and they run with it and they're passionate about it, and they're not being spoon-fed anymore. And so she's an example of that. And then another student, Zora Aslami, she's a medical student in my lab, and she is creating a new model for spasticity, so we can understand the mechanisms of these different surgeries we're doing for spasticity. And so again, another example of taking a project, we talk about the concepts and I chart the path, and then they take the football and run with it. And you can tell the students who are passionate, and it's just they will take things in a whole new direction, and that's what I really like to see.
And Sammy, just to clarify, those students are spending dedicated time in your lab, right? They're not like...
Yes. They both start off as summer students who then transitioned into 1 year, and then Erica did a second year, and now she's doing her MD PhD. And then Zora did a summer in the lab, and now she's doing a full year. So it's a good way to do it, I think, because you can feel out the lab, you can see if it's what you want to do, and then the PI can get a feel for you also, and see if they want to commit to having you in the lab for a year.
We have about 6 minutes left. So I think maybe in the interest of time to try to get through a couple more questions, maybe we'll move on. So one of the next questions is, I've seen a lot of low impact, low volume surveys or opinion polls that get published. Personally, it seems like these are done to boost publication numbers for applicants, but is this something that we should be doing? I agree with quality over quantity, but it's hard to not get spooked by the high numbers of publications that other applicants have. So my personal thought on this is I'm always going to look at the quality of the publication. To be quite frank, like a first author paper in JAMA, or like you're the first author paper on a good quality study in like plastic surgery, the White Journal is going to get more traction from me than something that's like, a survey study that like everyone is on, and it's like in PRS Go, or it's on like some new kind of like journal. I do agree that we sometimes look at the numbers overall, but I think when we're actually getting into the application, most of us are going to look at the quality, but I'll let everyone else chime in as well.
I definitely,
most plastic surgery research isn't great quality to begin with anyway, realistically. So part of the quality over quantity is more like, not when I mentioned that earlier, is more like don't spread yourself too thin, so you can put enough effort for a project, and make sure it's a project that you're interested in. I probably wouldn't be, it's hard without spending dedicated time to get involved with the very good, like high impact project realistically. Like you're not gonna be able to be like part of a clinical randomized prospective placebo-controlled trial, or with like a sham surgery case, it takes like years and years and years and a lot of funding or basic science stuff. So yeah, I mean, it's fine to be, if you have like a better quality project, I think it'll get attention. And maybe during an interview, you could find an opportunity to talk about that specifically. The other way to sort of boost quantity for academic productivity without sort of hindering quality is taking advantage of sort of local, medical student poster day or whatever. There's like a lot of local things that don't cost money to go to and take most posters, and it's just not a lot of extra things for or effort for time you've already spent for a project. And so take advantage for those, because they could also add lines in your CV for things you've already done without wasting sort of more time and effort and energy.
I totally agree with you, Al. I feel like a lot of the projects that might be deemed low quality are the entry-level projects for a lot of students. So, you might, maybe we're doing a survey because we're going to do something 2 patients or 4 patients as a second step. The survey might be where you can come in, especially if you're trying to interface with somebody who's not at your home institution. That's a project maybe that doesn't require, a significant IRB or chart access to be part of. So it could be a possible project for a lot of people on this call.
There's no reason to do everything alone either. Like you could have another student and the 2 of you can be doing chart review. One of you is going to take the lead on one project. The other person's going to take the lead on the other project. And it feels like you're doing one project, but you get 2 papers out of it.
All right, last question to finish us off. In your experience of being a research mentor for medical students, you find that students on a research year can contribute more meaningfully in clinical or basic science research. So these are students taking a dedicated year. And then has this been changing as research has become more important to residencies in lieu of USMLE scores, which, as we all know, starting this coming year, will all be pass-fail for step 1?
I think we're biased. I mean, I love the basic science people. You guys are like special, like you really like gotten into it for a full year, but you might get 1 paper out of it and that might feel not that great. So you might want to diversify a little bit, but if you're going to take a full year and do clinical research, I'm expecting a few papers, which may or may not be reality for whoever you're working for.
But I would counterpoint you there, Sue, and say it depends on, I think, really what you're doing. I mean, my research assistant this year, she did a master's program and they take a full year off. So she worked with me. And I said to her, like, I think that when people are going to look at you, they're going to judge the success of your research time as to what did you do. So you spent 12 months doing research, you wrote 10 research papers, like, great job. But if you wrote 1 paper, as somebody was saying before, and you're the first author of a Nature paper, people are going to take notice of that. Like maybe if that was your only project, I think that would be super justified, even though it's 1 versus 12. So it's really a quantity versus quality. And I think people will notice that as either, on your application to say, wow, this person did, a Nature bench science paper, like this is some serious business. That would definitely qualify, as good work for 1 year for just 1 paper, probably.
Oh yeah.
Yeah. Just to kind of echo what Joe said, and what Sue said, it's really not all basic science is the same, and not all basic science papers are the same, and not all projects are the same. So if a lab is focused on mostly putting out, high impact papers and high impact journals, that is, where it's like over 10 impact factor, or like Journal of Clinical Investigation, that takes like years to come up with. It's like it's really like multiple papers in one. What would be like 1 paper in PRS would be like, you'd have to have a lot of those to be the 1 paper in like JCI. And so it depends. If that's what the lab is doing, 1 year is just not going to be enough. You're going to be like the middle author contributing to 1 paper and take a long time to do. So if you're only spending 1 year in the lab, probably you're going to, in terms of productivity for number of papers and buffing up your CV and the lag time for like responding to like a high impact basic science journal, you're probably be better off for the most part with clinical research, unless it's a lab that's also doing sort of smaller projects and cranking those out too. So it all just depends.
Yeah, I agree, Al. I think it's important to come away with a first author paper, regardless of what you're doing. And so you don't want to find yourself going into a basic science lab where that's just not feasible based on the scope of the work being done and the projects you're being assigned. So, in terms of strategy, I think that's something concrete you can focus on. And, some people in the lab will take that opportunity to, spin off a couple easier, smaller clinical projects just to add more lines to their CV and actually make more connections and build more mentors. And I think that's a great thing to do also. But first and foremost, just decide what speaks to you more. And you can do really outstanding, impressive clinical research. And you can do great basic translational research, but find a good lab with a good track record and make sure it's in line with your interests. And because if you don't enjoy it, you're not passionate about it, you're not going to be productive and you're probably not going to do good work.
All right. Well, to respect everyone's time, it's 8:01 now. So thanks for everyone for tuning in, and thanks for our panelists. And feel free to contact us if there's more questions. But you have a good evening.
Thanks,
Bye,
Al.
everyone. Thank you.
Have a great
Thanks,
night.
Al. Thanks, guys.
Bye. Thank you, Al.